Hello everyone, this is Aditi again. Welcome to track 5 of Annual Patient Safety Conference 2023, which is titled The Future Safety Champions, to be chaired by our very own greatly respected Dr. Mrs. Unmana Borgohain Saikia. Ma'am is the National Vice President of ANEI and also an entrepreneur. Ma'am is the principal of Asian Institute of Nursing Education and Nursing Director of JNRC Hospital Limited. Madam has an exhaustive arsenal of experience and a deep motivation to guide us, her students, onto the path of excellence. Under her able leadership, we have had opportunities which are laudable by all standards, and she has our everlasting gratitude and respect. Now, I request Professor Dr. Mrs. Unmana Borgohain Saikia to kindly initiate the discussion.
Thank you very much, Miss Aditi, for your sweet introduction. Am I audible?
Yes, ma'am, you're audible.
Yes, ma'am, you're audible.
Okay. With leadership, anything is possible. Without leadership, nothing is possible. So before I move on to the future patient safety champion, I bow to our ANEI leaders and master champions, Madam Thankam Games, and founder president, who is giving a heart to this event since last 2 years. This is the 3rd year now. And Madam Ajita Nair, ANEI current president, for untiring support and commitment. Despite tremendous progress in improving patient safety, modern healthcare system still have a long way to go compared to other high-risk but low-error industries like banking and transportation. Yes, it has been well said in the morning. An incident in healthcare is just tip of the iceberg and sign a much larger problem below the surface. But a champion never fear of danger and never defeat. Here I am presenting in front of you all majestic young nursing professionals and students from different states, 6 states particularly of India, representing their ideas for future safety champions. So I would like to welcome our panel of staff nurses, Ms. Jisha Gopal. Can I see you all on the video? Jisha Gopal, Raheja Hospital, a Fortis Associate Maharashtra, Kashishi Shisha Apollo Excel Care Hospital, Guwahati, Assam, Miss Vinci Prabha, Staff Nurse, Kaveri Hospital, Tamil Nadu. Okay. Then I also would like to welcome the panel of students. Miss Ankita Nayak, West Bengal College of Nursing, West Bengal. Miss Rasana Thakur, Miss MS Ramaya Institute of Nursing Education and Research. Miss Anjali Shukla, Holy Family College of Nursing, New Delhi. Yes, people say that nurses are backbone, but I don't like to hear that. I always like to hear that nurses are the central nervous system. And particularly the theme has chosen for safety champions, patient safety champions. The moment we say champions, like, it is something probable. Sorry, it's getting automatically probable, possible, that we are looking forward and we have a lot of scopes to improve upon and to do much more. I am really proud to share this session with exuberant youngsters. On the very onset, I would like to put forward a preliminary question to our students group. Students, hope all of you are ready. I'll be throwing a question to all of you, the same question, but I'm sure this question will lead to a different perspective and different answer. What do you think? Are you prepared enough on patient safety during your nursing training? And do you think student nurses graduates with confidence that they need to be safe nurse? So I request all of you, Ankita, Rachana, and Anjali, and first and foremost, I call upon Ankita. Kindly share your experience.
Thank you, ma'am. Am I audible?
Yes, you are very much.
Ma'am, I would like to say that no preparation is as sufficient to be termed the word enough in a profession like nursing where there is no end to learning. However, the existing curriculum has been inculcating within us the concept of patient safety through various multidimensional approaches, one among them being the safety standards assimilation, the international patient safety goals, which has been teaching us how to ensure correct patient identification, how to build effective communication, and how to prevent the health-associated infections. Secondly, to prevent the medication errors, which are one of the most common issues that compromise with patient safety. In order to prevent that, we have been taught how to maintain the 10 rights, how to apply the 2 identifier rule, how to handle the look-alike and the sound-alike drugs, and most importantly, ensure appropriate cross-checking before the administration of any medication, along with proper documentation. Elevate the voice of patients is what this year's theme is all about. Our curriculum has been teaching us that we as student nurses have the primitive responsibility to engage more in patient education, patient interaction, because the more informed they are, the more will be their compliance. And nursing is like a ladder. We always learn from our seniors and their experiences, because experiences help us differentiate what are erroneous and what are not. Therefore, the curriculum gives us the privilege to participate in these kind of conferences, which exposes us to the various issues and the challenges that are prevailing in the present scenario, so that we can groom us accordingly to be a confident and a safe future nurse. Thank you, ma'am.
Thank you very much, Ankita. Nice to hear you. Okay, before I comment anything, can I go to the next person, Rachana, please?
Yes, ma'am. Thank you, ma'am, for giving me this opportunity. So obviously, I'll be talking in a positive approach after spending 6, not 4 hours clinicals in first year and the ongoing 720 hours in second year. I would like to say that I'm prepared enough on patient safety during my nursing program. Nursing program specifically includes coursework and clinical experience that prepares students, especially the budding nurses, to prioritize patient safety. But the doubt really arises about the effectiveness of the preparation of the program, which varies depending on the time and the course curriculum. For me, it's essential to actively engage in the education and clinical methods imparted during my prescribed clinical hours, asking questions to the staff nurses and seeking the possible opportunities to learn and practice the effective patient safety management, which makes me self-sure as an upcoming future nurse, not appreciating to make errors, but would likely to point out the poor designed infrastructure or system, which includes the first and the foremost miscommunication, language barriers, not identifying the adequate needs of the patient, and also to keep in mind the ineffective teammates. Therefore, patients should be treated in a safe environment and protected from all sort of unavoidable harm, as well as the avoidable harm. Growing or developing countries like India, there are a pretty big combination of unfavorable factors like understaffing, inadequate structure, overcrowding, and a lack of healthcare facilities, shortage of basic equipments, poor hygiene and sanitation that puts emphasis on one single question: are the patients safe? Are they prone to any danger? A nurse's duty is to work for the patients as well for the patient safety. But What about the management of the hospitals if they keep a keen look about the staffing and the shift pattern of the nurses? I am not completely agreeing to the statement about the student nurses who graduated confident to be a safe nurse. A student nurse who is going to graduate soon should keep in mind about certain things. I would like to point out as about the patient safety, the most necessary element, like how system impact on quality and safety of healthcare and how poor communication can lead to adverse events. They need to know as well as to equipped enough to understand to manage these challenges, to develop strategies to prevent and to respond errors in the upcoming complexities. Now coming to the confidence of a pre-staff nurse upon graduation can vary widely depending on the basic individual experience. Education the most necessary and the proper training. While nursing programs struggle to provide students with knowledge and skills, they need to be safe at the same time to be an effective nurse. What I think is, it is completely normal to feel the blend of confidence and fear as they are transferring from student nurses to professional staff nurse. So a change of role in the life takes place. Coming to the factors that influence a student nurse's confidence are clinical experiences with ongoing time, supportive education from the hospital, self-efficacy, and continuing education during their job. Consequently, nursing programs aim to prepare students to be safe nurses. It's very common for the new graduates to experience an adjustment period as they transfer from academic setting to clinical setting completely. Confidence typically grows with time and experience as they gain competence and adapt to the demands of their profession. Thank you, ma'am.
So nice to hear you. Okay, can I hear from Anjali now?
Yes, ma'am. Good afternoon, ma'am.
Good afternoon. Please go ahead with your perspective.
Yes, ma'am. I think students are well prepared for patient safety as nursing programs aims to prepare students for the patient safety only. But before going for the clinicals, we need to get the students to learn through demonstrations, skill labs, simulations, and OSCE. After that, we will go for clinicals so that we get more chances to learn and experience and practice, and after that we get a lot of time in hospitals so that we can learn a lot of things and we get enough exposure and experience from the clinicals. As per INC, we are having certified hours of clinicals in hospitals. So when we get these kind of enough opportunity, we get enough exposure and experience, and it provides us opportunity for the patients to provide quality care to the patients. So at the end of the internship, I can proudly say that I can handle patients independently, and I'm well confident. Thank you.
Thank you very much. I'm getting very excited to hear three of you. Number one thing is that all of you said being positive and optimistic. I always believe in that. First, we have to have a thought, a positive thought that I can do it. I am capable. But moment we think, it makes it happen. If we have the open mind to learn, we can. But just to say about, if I look back my days and my time, in the terms of patient safety, yes, we have been taught the nursing care. The main central focus is the patient. That has been taught. Okay, but now I can see it is as a discipline. So many things, it is just coming up now. And about, yes, we have to take care of ourselves while we go to the hospital. Our teachers say, eat well, maintain the hygiene principle. That's not said. But now we are realizing many more the unsafe situation that we are exposed to the hospital, that we have to really take care of well before we take care of others. So others. But however, the way you express that about the curriculum, your positive attitude, and also about the ineffective team, and finally that you have to build up the confidence. It's wonderful to hear you, and looking forward that you are going to lead our nation, and definitely we are looking for safety champions and you. Thank you very much. So I'm coming to our young nursing staff. can I have your videos on, all our staff, Jisa, Kashishi, and Vinci? Okay, so I also will ask you a very simple question that you don't need to think, but all of you have to answer to the same question with your own experience. Let me take you back. For the very first day that you have joined in the hospital in your job, do you think at the time you were well prepared and well supported to practice patient safety? And can you remember any challenges came up during that time? This is a simple question for you to take back your first day in the hospital. May I hear from Jisha?
Yes, ma'am. Thank you, ma'am, for the question. The challenges which I have faced was like after completing my BSc nursing and start working as a staff nurse, bedside nurse. I was confident enough to be take caring of my patient. But when I reach into the my department, I was totally dependent on others because I was very good at communication with patient and skilled in a basic nursing procedures. But when it comes to the advanced nursing procedures, it was very different from what I have learned. But at that time, my in charge, she understand my limitation as a novice nurse, and she helped me throughout at the time when I came to the at one level. And my seniors colleagues also helped me in my patient care supports, and through this I got a confident enough to take care of my patient. Thank you.
I hear from Kashishi now.
Yes, ma'am. Namaste, ma'am. Namaste to one and all present here. I'm very privileged and I'm grateful to Annie for giving us this wonderful platform. Thank you, ma'am, for your question. Here, talking to the very first day when I've joined to the hospital as a staff nurse, yes, no doubt, safety was ensured to the patient. But the basic concept of patient safety was not clear when I have joined to the hospital as a young fresh nurse. But the thing which I can recollect from the very first day when I have joined to the hospital was like to put up the side railing of the patient to prevent from fall, and then putting up and to put the ID band for all the patient, and also like to put the stretcher belt or for the wheelchair belt to while transferring from one department to another department. So these are the few points, but I would like to highlight here because during those days, and I thinking that comparing to those previous days and today's present day, here there is a much difference because during those days we have not been heard much about like medication error, sample error, and suppose like if the patient has to be on restraint. Previously, I have not been aware, and we are not so aware like we have to take the restraint, consent, written order, all those things, and then monitoring for second hourly. And even when there is a sample error, then from the blood bank, from the lab, they will just call up and to send the sample again. But nowadays, what happens here, because if there is any sample error or if there is medication error, the leaders will turn up, they will find out the root cause analysis, what exactly happens. Then they will find out the problem, they will solve the problem. Here there is a much difference when I have joined to the hospital newly during those days and the present day. So I would also like to speak regarding the challenges when I have joined to the hospital as a fresher, as a young fresher. Because during those days, as I have joined to the clinical for the first time, there was, first of all, I would like to highlight regarding the communication problem. Because firstly, when I have joined and when we all have joined to the hospital, communication becomes one of the very important part, plays a very important part when we have to handle the patient. We have to go and communicate with the patient. So here comes a problem when sometimes we don't know how to speak Hindi and then the patient doesn't know how to speak English. Here comes a problem. So the challenges in communication problem is here when we really want to explain them what we exactly want to explain them, but sometimes we couldn't speak up to explain what exactly what we want to speak to the attendant as well as to the patient. And then secondly, I want to talk regarding the time management. When we have joined to the hospital for the first time, we have to tackle many things, like we have to perform multiple tasks. Here we don't know how to give preference because time management is very important. So challenges for the time management is that when we have joined newly, we don't know how to manage the time, which one to do first and which one to do later. So here comes the light in delay of giving medication. And then also, like sometimes we fail to take out the reports on time and inform to the consultant or to the doctors. Here comes the challenges which we face by a young nurse as a new joinee, ma'am. Thank you, ma'am.
Thank you so much. Very nice to hear you. So I quickly go to Vinci. Vinci? Vinci is not here? I can't hear you.
Vanakkam, ma'am.
Can you hear me?
Can you hear me, ma'am?
Vinci is there, but she is having the name of Ankita Nayok.
Okay, ma'am. Okay, ma'am. Okay, Vinci, can I hear from you?
Yes, ma'am. Vanakkam, ma'am.
Yes, please go ahead.
I remember on the day of joining in Cauvery Hospital, I had tons of fears and lots of queries while entering into the field. Like that, how am I going to deal with the patient and patient attendant? And how I'm going to deal with the doctors and my colleagues, and how am I going to take care of my patients if any queries during emergency situation or any other, to whom should I approach, and what I will do in case of any emergency. That way I had lots of fears and queries arising, but unfortunately, I need to undergo some various training programs arranged in my hospital. It includes certain nursing general induction program. It includes general induction for 5 days and nursing induction for 5 days and another departmental induction for 5 days. This will, from the day of joining onwards, it will be ongoing. So it will be helpful for me to, it includes some communication program and infection prevention, patient safety policies and procedure, infection control, and etc. It will be very useful for me to overcome my fear and challenges. And after completing my skill assessment only, I will assign to take privilege to take care of my patients. So it will be give more confident and more very useful to overcome my fear and challenges on my field, ma'am.
Hi, Vinci.
Okay. Nice to hear you. Actually, by hearing you all, that I'm really happy that you are careful about all the basics and root cause analysis, you all say, and you are sensitive enough now. That time you didn't know what is the time management, what is the priority, and about the induction training you are talking. If I think when I'm listening to you, I'm thinking my day. The first day when I joined in a hilly area, it is the 30-bedded pediatric ward with the 40 numbers of patients. And because then we're lying on floor. And there were some glass syringes and some disposable syringes were boiling together. Then, though during that time, my time, were no infection protocol policy taught separately, IPSC goal were not there, but whatever basics, a few things I have learned, that was totally even not there in the hospital. I was talking to my friend and others, what I learned, what am I going to do? That is my first day experience. After a couple of days, I have shifted to the surgery ward. And suddenly, middle of the night, one patient came with the chest pain, then patient almost collapsed, then connected the oxygen cylinder. A ward boy brought it to the ward. Then I asked, there is no flow I can see, oxygen flow I can see. Then he said, ma'am, cylinder is empty. Just think, then after a couple of minutes, the patient expired. That story, I'll never forget what I had. That is the one story. There are a lot of stories I don't want to share. Just sharing another story about the induction training or the in-service education. Just forget about it. It was not there during my time. It was 1994. So you can guess my age also now. 1994, I started, graduated myself. Then when I joined in 1999, after post-graduation in a super specialty hospital, when I have gone for the round, I don't want to name the hospital. Anyway, so that time they said, why are you coming to the ward? Even doctor said, you sit in the office. I was the postgraduate nurse, you sit in the office, I'll send you over there. The staff will be sending to you if there is any complaint. Anyway, just talking about the induction training, I call all the staff to the class for the classes, in service classes. They said, who are you to teach us? We are doing whatever we learn our nursing for so many days. So since 99 only the in-service classes started. So guys, you are very lucky and looking forward that you are going to deal the better way in the coming days so that you can be really safety champions. And my stories of those days, if I can erase out with the new upcoming generation and facilities with the hospital. Okay, so with this, I'm coming to the first round of question, and I'll go to the second round of question for you all. First and foremost, of course, I'll go to the students group. Okay, hope you all are alert now. Okay, students, what is in your opinion the academician need to do to make you future safety champions? So this will come to us, right? That how we have to prepare you. Please, I would like to ask here from Anjali, Rachana, then Ankita.
Thank you, ma'am. Ma'am, for the patient safety, I think there is a need of participation from both the sides, from the student side also and the teacher side also, because for providing quality care, there is a need of interest in the students to give care. So for this, I think teachers should provide includes new teaching strategies that allows learners to develop, refine, and apply knowledge and skills in a realistic clinical situations. Teachers need to make learners participate in stimulated patient care scenarios like OSCE demonstrations within a specific clinical environment, gaining experience and learning and refining skills and developing confidence, so that this is accomplished without fear of harm to life patients. So all this can help students to improve knowledge, skills, and expertise, so that quality care is provided to the patients and outcomes are optimized while errors are minimized. For this, I think teachers should need to be more friendly, and they should be approachable, so that the hesitations between the students and teachers can be minimized and we can provide quality care to the patients. Thank you.
Thank you so much. So I'll go to the next person now, Rachana.
Thank you, ma'am, for giving the questions. So, role of academicians to make student patient safe. In my opinion, I'd like to mention some aims that should be followed. First one is the prepare healthcare students for safe practice in the workplace. Inform healthcare educational institutions of the key topics in patient safety. Enhance patient safety as a theme throughout all healthcare professional curriculum. provide a comprehensive curriculum to assist teaching and integrating patient safety learning, further develop capacity for patient safety educators in healthcare professional education, promote a safe and supportive environment for teaching students about patient safety, introduce or strengthen patient safety education in all healthcare professional educational settings. Teaching and assessment strategies should be designed in such a way that takes into account both diversity in available resources and environmental differences. Coming to the structure, academicians' guide relates to join the capacity for patient safety education, program planning and design. Suggestions should be mentioned regarding how patient safety education might be approached and implemented. Coming to the techniques, brainstorming techniques that require and encourage everyone to suggest ideas to solve a problem. The problem being how to properly introduce the patient safety learning into curriculum. A patient safety guide has been designed for all healthcare students. Psychologists, nurses, doctors, and pharmacy faculties can teach how disciplines have made a safe environment. Activities to assist patient safety understanding can be lectures, small group activities, learning during clinical placements, case discussions, and situational role play. To ensure student patient safety, academicians in the healthcare related field should encourage the following things, like the comprehensive education, simulation training, interpersonal collaborations, clinical supervisions, ethical training, adherence to guidelines, assessment and feedback, patient education, research and innovation. By focusing on all these aspects, academicians can better prepare students to provide safe and high quality care to patients throughout their careers in healthcare. Thank you, ma'am.
Thank you. Thank you so much for your good elaboration of this particular point. May I hear from Ankita now?
Thank you, ma'am. I think it's high time that the nursing curriculum need to uplift their existing educational strategies and incorporate patient safety as a separate discipline in our nursing program, which would require taking a departure from the traditional old lecture formats, which only involves passive listening, and shift towards a more experiential learning environment that would facilitate active learning through the development of critical thinking and clinical decision-making ability. Ma'am, we don't want the boring, tiring written assignments. Instead, we want more and more simulation-based training in our curriculum that would help the student nurses experience the real-life scenarios and open us and expose us to the diverse patient populations and make us able to think critically. I think educational institutions train students more as individuals than as a team. But we need to remember that nurses are expected to work within a multidisciplinary team. Therefore, bringing up into action more and more team approaches and group-based activities is very essential. One of the common problems among student nurses is the error reporting fear. But if they will not report the errors, they will not be able to rectify them. And if they will not rectify, it will continue to harm the patient safety. So development and planning of some group discussion schedules with various healthcare team members would encourage and facilitate the student nurses to openly discuss regarding the issues and the challenges that they face in their clinical area that would help them overcome such fears. And on top, I would like to say that preceptorship facilitated practicums to bridge the gap between theory and actual practice are certain modifications that are needed in our curriculum to make the students more patient ready. Thank you, ma'am.
Oh, wow, just wonderful. That's very nice to hear you all students. And at the onset, you said that it is not only teachers' responsibility, you are taking the ownership. It is the both. Vinci, can you put off your audio? it is the dual, both sides need to work together, the Anjali said. Then also the Rachana said that we have to have the strategies actually. And particularly you have mentioned, Ankita, that the assignments, yes, even I do remember writing the assignments during my MSc time, my this middle finger, it is still very tough, you know, but it also give me the memory of those days, whatever it is. But this is really, we can replace with the simulation technique and the assignments. Just now I'm thinking there's some real story kind of, when I'm talking about a particular patient disease, the writing pattern, we can change a little bit and make it more interesting, and that is important. And I love to hear that you said that we need a separate discipline. It is really coming up. It will be very soon. And I'm very sure ANEI will take some more steps that for developing the curriculum or developing this discipline, and or to propose to INC or whatever it is. Already many changes came up. It is already in the curriculum, but according to your expectation, looking forward, many more changes. Thank you, each one of you. That is over your second round of question. Now I'm coming to our young nursing staff with the second questions. Yes. So you started your journey and you have remembered well, but now that time also you had some problem, but now you realize what is the patient safety. Am I right? And you have accumulated a lot of experiences, knowledge, and now you know what are the patient's right, and patient is safe or unsafe during the care. So what are the barriers for you when you want to speak up that patient is not in safe condition? That is my first question. Second is, what do you expect? They said about the academician, I am asking you, what do you expect from hospitals to do to ensure the safety of the staff at their workplace? So with this question, I would like to go to Kashishi. Would like to hear your response to it.
Yes, ma'am. Thank you for your question, ma'am. Yes, speaking about the barriers for us to speak up when we see the patient unsafe. Here, the first point is I would like to highlight regarding the staff-patient ratio. Here, if you are handling with many patients, sometimes like staffs are less and then the patients are many. Here, when the staff are handling many patients with the busy environment, running from one corner to another, and then sometimes here comes an error. There might be unsafe things for the patient, but here comes for the staff nurse to speak up when they see something unsafe to the patient, because they don't have adequate time, because they don't have sufficient time to talk about the patient safety, as well as to address the safety concerns appropriately. And then talking secondly regarding about the power dynamics. Here, talking about the power dynamics, for example, I would like to take an example like if the doctor has call over phone, if the consultant has call over phone to give one medication for his or her patient. So here, sometimes we, the nurses, sometimes used to get inappropriate information because thinking that what doctor will think if we ask him again and again, or having a mindset or fearing that if I ask from the doctor again and again what he will tell me, he might scold me or he might get angry. So sometimes we didn't get appropriate information. This is because of the power dynamic. So like previously, because giving advice through phone over phone was very high. But as the time has advanced, it has been improved a lot. And then talking thirdly, I would like to highlight about incident reporting. Here comes incident reporting because sometimes we see something unsafe, but we fail to speak up. What is their main reason is that some staff, they think that if we have informed this regarding this incident, regarding this wrong medication or wrong sample, something has happened, but still some staff has to fail to speak up because they think that when we did mistake, we have to inform to the higher authority. We have to inform to our in charge, to our leaders. And there we have to write an incident report, post-incident huddle. And for example, like raising in the AIRS, all these things have become an error. So I would expect from the hospital to give appropriate staff-patient ratio if in need, and then also to provide equal power to both the doctors or to the nurses or to the staff, as well as regarding this incident reporting, instead of the leaders and the in charges, whoever it may be, instead of giving punishment of scolding, they should, if they have corrected us and guide us to the right way, it will be a better one. Thank you, ma'am.
Thank you so much, Kasisi. Very nice to hear you. Concluding remark I'll give all together. May I call upon Vinci now?
Yes, ma'am.
Yes, Vinci, go ahead.
As a nurse, we are facing a lot of challenges and barriers providing patient care at different stages. Let me share some of the barriers what we have faced. Fear. Fear is the first and foremost barrier in our nursing field, and other barriers are lack of knowledge, lack of confidence, less motivation, hesitate to speak up or communicate, and hesitant to report. For example, if a patient came with the complaints of epigastric pain, who is a case of coronary artery disease, admitted and treated. She was prescribed a tablet Clopilate A 75 mg once a day, and along with the tablet Ecosprin 150 mg